So this is our psychiatry project. I'm Jamie Bornstein-Laurie.
And I'm Rochelle Elda.
So the educational background that you would need to become a psychiatrist would be 2 to 3 years of undergraduate university education, 3 to 4 years of medical school. You could also take a 4-year bachelor degree program, and that's because getting into medical school is extremely competitive, so it's not uncommon for people to complete a bachelor degree before applying. Then following all that, there would be a 5-year residency. So the programs of study in CEGEP would be health sciences or honors sciences. So you would do English, French, humanities, phys ed, and your science options. Then, in university, you would have to do your Doctor of Medicine. For the university courses you would need, the first year would be the physicianship courses, which address a number of important psychosocial issues. The second year is psychiatric lectures, including Introduction to Psychopathology and Suicide, and Mood, Anxiety, and Psychotic Disorders. There would be 2 group activities during the Pathology, Treatment, and Prevention of Disease unit, Introduction to Clinical Medicine, during which students are familiarized with the psychiatric examination and the functioning of the psychiatric emergency room, and Introduction to Psychiatric Clerkship, which prepares students for third-year clinical work. The third year would be the clerkships, practicing of medicine under supervision, taking place, which includes an 8-week clinical rotation in psychiatry. And the fourth year, there would be a number of psychiatric electives that are made available to interested students. So the field experience that you would need, there would be a 1-year residency in a hospital as part of the program, but you would also need to complete residency after the program. So a resident is when you're a doctor studying underneath a doctor, so you're actually working in the workplace, but you are not a full-time doctor, you still have to report to a supervisor. So the length of study would be 2 to 3 years of undergraduate university education, 3 to 4 years of medical school, and then 5 years of residency afterwards, which gives a total of 10 to 12 years of study. The top 5 schools in the field are Harvard University, University of Oxford, University of Cambridge, Stanford University, and Yale University.
Some of the different things that a psychiatrist do include counseling patients, prescribing medication, ordering laboratory tests, and conducting physical examinations. The environment you'll be working in is a courthouse or police station or criminal detention center if you're a forensic psychiatrist. On the other hand, a clinical psychiatrist might work in a hospital or any other mental health setting, and usually works in private practice. Psychiatrists are often self-employed. The working conditions of a psychiatrist include being indoors in well-lit rooms. Hours of work can often go over 60 hours a week. Psychiatrists are sometimes asked to come in at irregular times to evaluate patients, and they're at risk of maybe having to deal with aggressive or violent patients. Some of the responsibilities of the job are assessing, diagnosing, and treating patients suffering from mental disorders, performing psychotherapy, and consulting with other members of a treatment team. As for the salary, on a yearly basis, the average is usually greater than $163,660 per year.
A typical day for a psychiatrist working at a hospital would be 8:30 to 11 would be going to the hospital, speaking with staff and hospital administrators, going over files of the psychiatric patients there, taking notes for a report. Then between 11 and 12 is organizing the information, beginning to write the report on the effectiveness of the psychiatric program at the hospital. 12 to 1 is lunch, 1 to 1:50 is the first patient of the day, 1:50 to 2:40 is the second patient, and 2:40 to 3:30 is the third patient. What we like about the job is that you get to actually help people, so you can make a difference in somebody's life, either by helping them through some issues that they're going through, or in helping to cure a deep-rooted mental illness. Also, the ability to explore the fascinating human psyche, so it's a good job for people who are interested in how the human brain works. Also, it's an interesting job that is constantly different, no 2 days are alike. On the other hand, the cases that you deal with can often be disturbing or depressing, so it can be a real downer because you're essentially spending your whole day having other people put their problems onto you. So you need to be able to, at the end of the day, be able to leave all of that at work and be able to go on with your own life without worrying about everybody else's problems. Also, there's the chance of failed cases. So since you're dealing often with depressed people, there's the chance of suicide, so that can be upsetting. Also, confidentiality, in that you're not allowed to disclose what you hear to anybody else. So the progression of the job would be starting at being a resident, where you are still a psychiatrist, but you do have to report to a supervisor. When you're a staff psychiatrist, you can fully take care of admitting, diagnosing, and treating patients, and also overseeing the resident program. When you're a psychiatrist in private practice, you essentially take care of your own business.
Market demand. The job is currently in great demand. The Bureau of Labor Statistics has predicted an annual growth in psychiatry at 14 to 20% through 2016. There was an increase of roughly 20% from 2009 to 2010. The increased demand means that there are a lot of opportunities available to psychiatrists, but they may not be in the location or practice setting that candidates were expecting. It's still a very competitive process applying for the job. Shortages of psychiatrists exist mostly in rural areas and in public facilities. The field is definitely growing as technology advances and mental illness becomes more widely accepted. Psychiatry is usually a private practice in which the government is not involved, unless the psychiatrist works at a hospital. In that case, it would be under Medicare. In the last few decades, the quality of psychiatric treatment has improved vastly. People who had mental illnesses used to be shunned by society and locked away. They were also often treated in an incorrect and painful way, with electroshock therapy and lobotomies when completely unnecessary. Nowadays, talk therapy is usually conducted and appropriate medication prescribed. The aim is to help patients and not harm them.
And this is our bibliography. So thank you for listening to our project.
Bye.